Welcome to this module on critical appraisal of systematic reviews. In this module, we'll demonstrate the key features of systematic reviews and the process for rapidly critically appraising them using the Faith Critical Appraisal tool. Systematic reviews are a type of research in which all studies meeting pre-specified criteria are collated and reviewed in a standardized systematic way to give a complete, objective and transparent overview of all the evidence addressing a specific question. Not all systematic reviews are created equal. While systematic reviews should be conducted using pre-specified methods that minimize bias in the identification, selection and synthesis of the included studies, often they are not. Hence, we need to be able to critically appraise reviews to determine the trustworthiness and value of a review for informing our clinical decisions and actions. There are many tools available for appraising systematic reviews. Some tools help you do rapid appraisals and, as the name suggests, can be applied very quickly. Common rapid appraisal tools for systematic reviews are the CAHPR checklist and the Faith checklist from the University of Oxford. Both tools assess similar key components of review conduct where bias can be introduced, so which you choose is a matter of personal preference. There are some appraisal tools that are designed for very detailed assessment of risk of bias in systematic reviews. AmStar is an example. These tools are suitable for appraising systematic reviews that are being used to inform practice guidelines or policy. We'll focus our attention in this module on rapid critical appraisal using the Faith appraisal tool, as it focuses on the critical elements, is quick to complete and easy to remember. We should point out here that most systematic reviews aim to review studies about the effects of treatments or preventative therapies. These are known as systematic reviews of interventions. But systematic reviews can be conducted to answer questions about many other things, such as the accuracy of diagnostic tests, prevalence, risk or etiology, the prognosis of conditions and phenomena, where qualitative studies are reviewed. Though many of the steps involved in doing reviews of qualitative evidence synthesis are similar to those of quantitative reviews, the Faith tool applies best to reviews of quantitative studies. Faith stands for Find, Appraise, Include, Total Up and Heterogeneity. Each of the Faith items corresponds to the key steps of review conduct. For Find, we consider whether the systematic reviewers have used methods that are likely to find all the studies answering the review question. For Appraise, we want to check whether the reviewers assess the quality or risk of bias of the studies they've included in the review. For Include, we want to see that the reviewers have only included studies that are sufficiently valid for the type of question asked. This means both that they've included studies of the strongest design for answering the question and that those studies are of high quality. We also need to consider whether the results of the included studies are synthesized or combined using appropriate methods. This is the totaled up item of Faith. H stands for heterogeneity or variation in the results of the studies included, which should be assessed and explained. For each item of the Faith checklist, we answer yes, no, or unclear if there's insufficient information. When doing a rapid appraisal, it's not necessary to read the review paper from start to finish. The information you'll need to apply Faith is usually found in the Methods and Results section of the study. By using Faith to focus our attention on the key aspects of review conduct where bias can be introduced, and by doing focused reading of the research paper, we can quickly assess the key threats to the validity of the review. Before you begin appraising a review, it's important to determine the question the review is asking. We can identify the review question quickly using the PICO framework. PICO stands for the patient, population or problem of interest in the review. For reviews of interventions, I refers to the treatment or preventive measure that might affect a health outcome. C is for the comparator, that is what the intervention of interest is being compared to, and O is for outcome. This refers to the factors measured in the review to determine the effectiveness of the intervention studied. You can usually find this information in the review title and abstract. The review question should be clear and focused because it's used to guide the rest of the review process. It directs the searcher for studies to include in the review and the eligibility criteria against which studies are assessed for inclusion. This step also helps you decide whether the review is relevant to you. If your interest is in comparing two different types of counselling for the treatment of anxiety, for example, you would want to make sure the review includes studies that compare these two treatments, rather than just studies that compare one of the types of counselling with no counselling. Or if you want to know about the benefits and harms of a particular treatment, you can determine this by looking at the outcomes reported by the review. If it does not report the harms of a treatment or the outcomes are not what you would consider to be important to your patients, you may not want to continue with the appraisal. First question in FAITH asks whether it's likely that all relevant studies addressing the review question were identified. Systematic reviews aim to provide a summary of all the available research addressing a specific question, so it's critical we consider whether reviewers conducted a search that would be likely to identify all the available studies. You'll find information about how reviewers have searched in the methods section. Ideally, reviewers would have searched a range of sources for both published and unpublished studies. To identify published studies, reviewers should conduct searches of bibliographic databases, and they should search at least 2 of these. Searching a range of databases is necessary because not all published studies will be indexed in a single database. For reviews relevant to healthcare, we'd expect to see a search of Medline or PubMed and at least one other general database, such as Embase or Cochrane's Central Register of Controlled Trials. Depending on the topic of the review, other discipline, subject, or location-specific databases may also be searched, such as CENAL for nursing and allied health research and PsycInfo for research related to psychiatry and psychology. Reviewers should clearly describe how they searched those databases. The words and terms used to search the databases and how they were combined should be clearly described or available in a supplementary document. The search should look sensible to you and should include the terminology you would expect and any other alternate terms for a concept that might be used. The date of the search should also be stated so you know about the currency of the review. Whether any limitations on the search, such as date or language, should also be stated and be reasonable. It might be reasonable to search only the last few years for studies of a new technology, but restricting a search to the last few years when reviewing studies of an established technology would not. In addition to conducting a comprehensive search for published studies, ideally reviewers will also search for unpublished studies. This is often called the grey literature. The reason this is important is that studies with optimistic results are published more often. As such, we may get a biased view and over-optimistic review conclusion when only published studies are included in reviews. Unpublished studies require a lot more effort to find, so not all reviews attempt to do this. Unpublished studies may be identified by contacting relevant organisations and individuals researching in the area of the review topic, checking reference lists of related systematic reviews, and databases of dissertations, theses, and reports. Clinical trial registries, which are publicly available online registers of planned, ongoing, and completed clinical trials and some observational studies, are an important source of unpublished studies, and searching such registers is a key feature of a comprehensive review search. Finally, the reviewers should clearly describe the results of the search process. Ideally, this is presented in a flow diagram that may look something like this. A key feature of good quality reviews is clear and transparent reporting of the processes and results of the search conducted. Here we can clearly see the numbers of references retrieved by each search, the studies excluded, and the reasons for their exclusion. When we consider the methods used by the reviewers are likely to identify all the relevant studies addressing the review question, and they clearly report the results of their search efforts, we would answer yes to this checklist item. At a minimum, we would expect reviewers to search more than one database, search those databases appropriately, and implement at least one other method of identifying published studies. If we do not feel the effort to find studies was sufficient, for example, if a review only searched one database, we would answer no to this FAITH checklist item. This FAITH question asks whether the review authors assess the quality of the studies included in the review. This is necessary to inform the interpretation of the findings of the review and may also be used to exclude certain studies from analysis. The findings of a review should always be read or understood in light of the quality of the studies included. As a reader of a review, we should know whether a review finding is based on studies that are high quality or at low risk of bias, or whether the findings based on low quality, high risk of bias studies, or something in between. You should find information about how quality assessment was conducted in the methods section of the paper and the results of that assessment in the results section. The review should describe clearly how the quality or risk of bias in the included studies was assessed. Ideally, a process to ensure that the assessment of quality is objective and standardized should be used. This would usually involve 2 or more reviewers assessing each study, with the involvement of a third when disagreements arise. For systematic reviews of interventions, ideally the quality of included studies is assessed using the Cochrane risk of bias tool, which assesses bias arising from the randomization process, blinding and measurement of the outcome, missing outcome data, and selection of the reported result. But other appraisal tools may be used. They should, however, assess these important domains of bias. The I of faith stands for include. Here we consider whether the review included studies of the best design for answering the review question and of the highest quality. Systematic reviews based on studies that are not of the best design or are of low quality cannot deliver useful and robust information and insight. There are 2 things to consider here. First, are the types of studies included in the review the best design for addressing the review question? Making a judgment about this depends on the type of systematic review. For systematic reviews of treatment, for example, randomized control trials should be included. Observational studies may also be used to determine the effects of treatment, but are more subject to bias and confounding, so may reasonably be left out of this type of review. Secondly, are only the high-quality studies of that design included, with the rest of the studies relegated to the bias and confounding trash can? An example of this would be to exclude studies without adequate randomization or studies that fail to blind outcome assessors when it's possible to do so. It's not often that reviews do this, though. You're more likely to see assessments of quality being used to exclude studies from certain analyses or to conduct sensitivity analysis, whereby analyses are conducted with and without low-quality studies and the results compared. This is informative because it helps us understand the influence of the low-quality studies on the review findings. If a review includes studies of the best design for addressing the review question and only includes studies of that design that are of high quality, we would answer yes to this checklist item. If the review includes studies of the ideal design and assesses the effects of study quality in a sensitivity analysis, you could also answer yes for this checklist item. Systematic reviews bring data from the included studies together to draw conclusions about the evidence addressing the review question. We need to consider whether appropriate methods were used to synthesize the studies by looking at information in the Methods and Results section. Systematic reviews usually summarize the findings of the included studies in one of 2 ways. Statistically, using a technique called meta-analysis, which pools the results of individual studies to provide an overall summary estimate or average effect of the intervention. Or narratively, that is by using text to describe and discuss the findings of included studies. Though narratively synthesizing the included studies is sometimes all that's possible due to incompletely reported data, narrative synthesis does provide more limited evidence for healthcare decision-making. This is because, as readers, we have a much bigger job to try to make sense of the research ourselves. It's often difficult for us to discern whether all results are reported and reported equally. That is, to determine whether some results are privileged over others without valid reason. When reviews combine the results of included studies, we need to be able to determine whether this was done appropriately. Information about this will be found in the Methods and Results section of the paper. The correct way to combine or pool the results of included studies is in a meta-analysis. Here's an example of a forest plot, which is the way the results of meta-analysis are typically displayed. The forest plot shows the results of each individual study expressed in a standard way. In this case, it's the risk ratio, also known as relative risk, which is the ratio of the risk of the outcome in each study group. The diamond at the bottom of the plot represents the overall pooled effect from the included studies. In a meta-analysis, weight is given to each of the individual studies according to the amount of information the study contributes, so that larger studies contribute more to the overall summary estimate than smaller studies. This is the correct way to pool the results of individual studies. Reviews should not simply count the number of studies that are positive and negative, or count the number with statistically significant and non-significant results to draw a conclusion. Combining the results of individual studies without weighting them according to the information they contribute is also not appropriate. When a review uses a method of meta-analysis to combine or total up the results of individual studies, we would answer yes to this checklist item. The final item of faith is heterogeneity. Heterogeneity refers to variability among the studies included in a systematic review. What we want to know here is whether the review authors did a good job of assessing and explaining any variation in the results of studies included in the review. This is critical for us to understand how the results might apply to our patients or problem. Even though reviewers deliberately seek to include studies addressing the same question, the included studies will often differ in terms of the participants included, interventions studied, or the types and timings of the outcomes reported. For example, reviews of counselling interventions may include studies where the counselling is provided to individuals or is conducted in small groups. This type of variation is known as clinical heterogeneity. There may also be differences in the way the studies were conducted or differences in the quality or level of bias. This type of variation is known as methodological heterogeneity. Both clinical and methodological heterogeneity lead to variation in the results of the studies included in the review. This variation in the results of included studies is called statistical heterogeneity. Authors of well-done reviews will only meta-analyse or pool the results of studies that they consider sufficiently similar in terms of their populations, interventions, comparisons, outcomes and conduct, so that clinically meaningful assessments of the effects of interventions can be provided. When studies are combined in meta-analysis, review authors should assess the level of statistical heterogeneity present and attempt to explain it. When review authors do consider studies to be clinically and methodologically similar enough to be combined or pooled in meta-analysis, there will invariably still be some variation in the results of the studies. We can see that in this forest plot of studies comparing specialist palliative care and standard care on quality of life, that the effect of specialist care is greater in some studies than others. Reviewers should assess whether statistical heterogeneity or variation in the results of the included studies is greater than what is expected by chance alone. Ideally, statistical heterogeneity is assessed using the chi-squared test, which tells us statistical heterogeneity is present when the p-value is low. This is usually less than 0.05, and the I-square statistic. The I-square is particularly helpful because it quantifies the amount of variation in study results that's due to differences between the studies in their PICOs and methods rather than due to chance. When these tests suggest heterogeneity is present, and it is likely to be important, generally this would be when I-square values are around 30 to 40% or higher, good reviews will have explored the reasons for this variation. This helps us to understand more about the circumstances in which the effect of the intervention may vary. It helps us understand why an intervention may work in some instances and not others, and improves our understanding of the factors that influence the intervention and what results you can expect should you implement it. When review authors have assessed heterogeneity using these tests and attempted to explain any variation in the results of the included studies, we could tick yes to this checklist item. Reviewers may explore heterogeneity in systematic reviews through subgroup analysis. In subgroup analysis, studies are analysed within subgroups with similar characteristics. In this review, for example, the effect of specialist palliative care is compared in people with cancer and non-cancer conditions. While subgroup analysis can help us begin to understand more about when and where the intervention might be more or less effective, the findings should always be interpreted with caution. This is because subgroup analyses are observational in nature. Participants are not randomised to cancer and non-cancer conditions, so may differ in other important ways that could explain the relationships observed. They are exploratory in nature and should be based on features the review authors had specified at the beginning of the review as possible reasons for variation in the results of studies, based on the existing literature and their clinical experience. We've reached the end of the faith checklist. The questions in the checklist draw our attention to the key aspects of review conduct that can lead to the introduction of bias. This includes whether review authors use methods likely to find all the relevant studies addressing the review question, whether and how they assess the quality of those studies, whether only the studies that were sufficiently valid for answering the question were included, and the results combined using appropriate methods, and whether variation in the results of the studies was assessed and explained. Using the checklist together with focused reading of the methods and results section of a study report, we can quickly determine the validity and trustworthiness of reviews. If you answered yes to all the faith checklist items, you can be confident that the review has been conducted in such a way that bias is minimised. If you answered no or unclear to most or all of the items, you may consider looking at a different review if there are others available addressing your question or uncertainty. If your appraisal has found some faith items a yes and some a no or could not be answered, the trustworthiness of the review is less clear. The seriousness or degree of deviation from the ideal methods for conducting the review needs to be judged to some extent. This can be challenging when you're new to critical appraisal, but can become easier with practice and further learning using the additional suggested resources. Remember, the point of critical appraisal is to determine how much trust you can place in the results of the review you're reading. Your interpretation of the results of that review should always be informed and coloured by your assessment of the risk of bias. We hope you've enjoyed this video. If you have any comments or suggestions for improvement, please use the contact information provided here. This video was developed by the Institute for Evidence-Based Healthcare at Bond University with support from the Council for Allied Health Professions Research, Northern Ireland Hub.